And I would suggest that all companies should mind and mine all of their user ratings. You'll find fantastic things.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. Today, we're fortunate to have Ken Robbins, CEO and founder of Response Mind Health. The topic today is health consumerism. Welcome to the Business of Healthcare podcast, Ken.
Thank you. Thanks very much. Glad to be here.
So Response Mind Health, what a name. I'll let you explain that name here in a minute, but I understand that you're a HIPAA-compliant digital agency that has a very long history of addressing consumerism. And today, consumerism has made its way into healthcare. It's been everywhere in retail for the longest time. So we can't avoid being involved with healthcare. So tell us more about the major areas of your consumer engagement.
Well, in terms of the actual work that I do and we do day to day, we are a direct-to-consumer marketing agency, and we have, since our inception in 2001, worked with healthcare companies, healthcare product companies, and also with retailers. Just general retailers, Home Depot, Staples, Carhartt, large multi-channel retailers. And I think that in the last 5 or 6 years, it just dawned on me that there is this confluence of the two. What consumers are experiencing in the transformation of retail, they are now demanding in other channels. And healthcare, frankly, has been a laggard.
Well, with healthcare being in the news all the time, you cannot avoid being involved with your healthcare, making choices and decisions. And it seems interesting that, one of the main topics today is this topic of transparency. It's a shame that 18% of the GDP in America, it's a multi-trillion-dollar component of our economy, is veiled in secrecy of pricing. And what do you see happening there in terms of visibility and transparency in healthcare pricing?
Well, the system works exactly as designed. That's no accident. There are arguably 5 or 6 major actors in the world of healthcare. There's the patient, the physician, the hospital, the insurance company, pharmaceutical company, and government. And the power of hiding information is incredible. So if I give you a discount, I certainly don't want everyone else to know I gave you a discount, because then they'll expect it too. And it's just as simple as that. And what I see happening is it's cracking wide open. It's cracking wide open from a standpoint of legislative policy and mandating transparency in pricing. But really, that's not the major thing that we'll see. What we'll see is that as prices are published, the free market will come in and demystify. So I can even hide my pricing by publishing my pricing. Let's say if I'm a healthcare facility, I can say this CPT code is $1,175 and this one is $2,073. And these items, these Q-tips, are 69 cents a piece. But what I can't do is I can't in my mind bundle that all together into the procedure. But the free market's just going to come in, and it already is starting to work to assemble all the bundles so you can say a knee replacement at this hospital is $15,000. A spine surgery with 2 fused discs is $140,000 at this hospital. And because of the free market rising up, that's going to take away this power of hiding that piece of information. But that's what I see happening.
So this digital world that we're living in, I attended your executive briefing, and I was quite frankly amazed at the level of digital engagement that directly impacts the consumer experience. And I talk about the consumer experience, I think of it in 2 different dimensions. One, as an individual being a consumer of healthcare, and also as a company that might be marketing and trying to work with people to help educate them in terms of becoming better consumers in healthcare. So do you work in both of those areas directly with consumers and obviously with the companies behind them?
Well, we touch on helping the consumers. I mean, that is largely our function. It is to, marketing is just communicating what you do and what you're selling out to the public. And so I think the legacy world of saying we're a great institution, we have won these awards, we're number one on U.S. News and World Report, we have a lot of doctors, we have a lot of latest machines. Those are positions that you're communicating out to the marketplace. But the market and consumers demand so much more, largely because of what you just acknowledged, the digital transformation of everything that we do. We demand speed, clarity, and process information in everything. Amazon is experimenting, and I'm sure they're rolling it out now because it's fantastic. Think about it. You order something from Amazon, and they're the poster child for excellence and execution. And you know instantly that you ordered it. You get a confirmation email. You know that it's been shipped. You know that it's in transit. And now, when they deliver it to my house, they take a picture of the item next to the front column or next to the front porch, so I see it's been delivered, and they send it to me. The item was just delivered. So I know it's safely there, and it's time to go out and pick it up. That's process information during the entire logistics of that package. We need that, and people love that. It makes them more engaged. You want to talk about making patients engaged? Tell them, hey, I just want to let you know, the physician has reviewed your file. There's been a meeting of oncologists to discuss it, and we look forward to you coming in next week to discuss our plan for your treatment. Well, usually that would be excellent level of service, an Amazon level of service, to give that kind of intra-process information while delivering healthcare. But sadly, we're not there yet. And what happens is it gets all the way down to the mundane day-to-day moments in user experience. We come in and we're told to wait, and we don't know how long it will be until we'll get taken back to the room. Then when we're taken back to a room, maybe there's a moment of diagnostics and prep with a physician assistant or a nurse, and then the door's shut. The doctor will be in a moment. That could be 2 minutes if the doctor is ready and he's finished with a previous patient, or it could be 15 minutes. Every minute that it takes only creates doubt, fear, and anxiety in the mind of the consumer, which they call a patient, but it's really a consumer. And so that's terrible. That's a terrible thing. Retailers couldn't survive if they did that to people. They have to give lots of information through the process to let people know where they stand. So I think that what we're seeing now, and I described this in my executive briefing, it's not really a disruption. People talk about disruption. Disruptions are temporary interruptions in the flow of a process. What we're seeing is a revolution. A revolution is a wholesale, violent upheaval of the way things used to be to a new way of doing things. We will never, ever go back to people not Googling their symptoms, not going onto WebMD, and not going out and crowdsourcing their diagnosis on user groups, Facebook, and their friends and communities, Instagram, Pinterest, etc. Because they're sitting there with the symptoms before they ever get to see the doctor. And all this information is available. So it is truly a health consumerism revolution in the world.
You know, recently we held a class on the digital business model, looking at how you must change today in order to survive and stay in business. And we looked at it from a variety of perspectives, but most importantly from the healthcare perspective. And there was like several questions that were presented in this course. And one of them is, what is the threat? What is the opportunity? Because recently I saw an advertisement from Amazon delivering medicine to your house in an envelope, ready to go, guaranteed to work perfectly fine, all done with artificial intelligence. And you sit there and you go, wow, that is a threat. If you're a pharmacy, that could be a huge threat. If you're Amazon, that could be a huge opportunity. But when you start to look at this digital business model, you look at the competitive advantage that you might have. And it leads you right down the path of mobility and the Internet of Things. But it's all driven off getting a better customer experience, like you just said. So what do you see happening in the mobility space? All these wearable devices that are out there, how does that impact the user experience?
Well, that's one of the big 9 trends. So John Nesbitt back in the 90s talked about megatrends, and he said that power has shifted from power in the hands of a few to information in the hands of everyone. That's now the true power. And there are these 9 big sub-trends under this huge trend of health consumerism, and one of them is just what you mentioned, which is self-diagnosis and wearables. So we're able to monitor so many things. I lost 126 pounds over a 4-year period. You know how I did it? I did it with MyFitnessPal, an app on my phone. I was already vegan. I mean, you can't eat any better than, or you can, but I was maybe an unhealthy vegan because I ate lots of pastas and breads and things like that, but no animal products. But I was a 329-pound vegan, and I used an app as my reinforcement and my reference information, and I keep track of every calorie I eat. I even to this day, 7 years later, I keep track of every calorie. All the way up until this afternoon, I can tell you how many calories I had in a day. And people are monitoring their heart, they're monitoring their blood sugar. And so now there's volumes of ongoing information rather than a physician only getting a snapshot during the office visit. They have available to them the entire history in between appointments of every event that's monitored, whether that's heart rate, blood pressure, blood sugar, exercise levels, activity levels, breathing, etc. Now, that's truly where I think that medicine and diagnostics have not yet caught up. The ability to ingest all that wearable technology and self-monitoring technology, self-monitoring information, isn't there yet. That's really a frontier that I hope and expect will be captured by entrepreneurs, innovation, health systems. But think about the power of that. You can literally look at every single thing I have eaten over a 7-year period. Nobody knows what to do with that because it's never been done before. And people are doing it en masse. There's 5 million people on MyFitnessPal.
Yes, and that's the start. From the physician's perspective, the past experience has been fee for service. I do things for you over and over again. I charge you for it. And the new model now is becoming population health. And population health requires looking at a great deal of data, analytics. And instead of taking care of 2,000 patients as a doctor, now you're taking care of 10,000 patients. But guess what? You can look at those 10,000 patients and you can intervene with them because of this data that you talk about that we're all archiving and collecting. So that's a pretty important component.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So at your company, do you do a lot of analytics and do you capture a lot of data on this consumer marketplace?
We do. Now, we're not clinicians, and we don't capture medical data in any way. What we do is we help companies find their patients and attract those patients. And usually what we find is that so much of medical marketing is either about the device or the technique or the facility. It's the messaging is centered on that. When really, what the best marketers in the world, and I keep referencing retailers because retailers live in an incredibly rapacious, competitive environment day in day. It's literally dog eat dog. And the Home Depots and Lowe's of the world do not care at all that Sears is going out of business. They don't care. They're happy for it to happen. So there's not a collegiateness. There is, I'm going to beat you. Even Jeff Bezos at Amazon says, your profit margin is my opportunity. So in the world of retailers, they have to communicate much more discreetly and directly with specific consumers. So they divide them up into groups. They say, for example, I have a business group that I need to market to, and I have a consumer group if I'm Staples. I'm going to market to small business, I'm going to market to large business, and I'm going to speak to them differently and communicate with them differently. It's not about the fact that I'm selling paper. I don't talk about paper and ink and toner. I talk about what your needs are, what your situation is, how can I help you? And so a lot of what we do is we use a client's database of their customers and we help them segment those, personify them, and communicate more directly with them, and therefore much more effectively. You can persuade people and communicate them and make your argument for what you need them to do, whether that's buying something or whether that's maintaining their health, if you can speak to them more clearly according to their needs, wants, and behavior.
A good example of that would be, I twist my ankle, I need an MRI. Where do I go get my MRI today? What are my choices? How do I, as a consumer, investigate that? And how urgent do I need that MRI? Maybe it's not, I have to have it today, but I should have it looked at. What's happening in the marketplace to make people more competitive along that line?
Oh, that's a great question. The first thing is, let's just acknowledge the truth of what happens. If a person gets hurt, unless it's immediately urgent, life-threatening, very acute life-threatening, unless it's that, if it's something that's symptomatic, they go online or a loved one goes online. Here, let me look that up. My wife woke me up 6 months ago at 2 o'clock in the morning and said, I have a pain in my arm. Can you take a look at it? I looked at it. I said, there's some red streaks. We looked it up online. It turns out she had cellulitis in that arm. I took her to the emergency room immediately to get antibiotics. Now, I'm not a doctor, but I successfully approximated a diagnosis and got her in. So in the case of needing something like an MRI, a sprained ankle, well, the consumer is going to go online. Is it sprained? Do I really need to go to a doctor? It hurts. Did I just twist it or did I break it? And when they go online, they're going to see lots of information about the symptoms and things they can do. Put some ice on it, elevate it, etc. But then they're going to see all the ads for their choices. It's really, consumerism is about choice. The consumer is king. So I can go to the emergency room. I can call my own primary care physician and ask them for a referral. I can go to an urgent care. Or there are fantastic competitors springing up like American Health Imaging, based here in Georgia. And American Health Imaging has a sign in their waiting room that says, don't fall for the hospital's tricks. Pay cash and save. And so I can either go get an MRI somewhere for, say, $1,300 at a hospital and have 3 or 4 days to schedule it, or I can walk into there and pay $350 and get it cash on the spot, and I know instantly. Now, the high deductible plans we're all living with, really, that puts people in a self-pay mode, and it makes them shop. And so I think, this is going to break the model. It's the finances, the personal finances of the individual that is going to drive the breaking of the model, and the vehicle to do it is all the information and choice available through things like the internet, smartphones, and self-monitoring and these things.
Well, I agree. The education component here of being a consumer is paramount. When you look at your healthcare needs, you need to look at it over a multi-year period. You mentioned having, a high deductible health plan where you have to pay out of pocket for a variety of things. There may be an out-of-pocket maximum that you have to budget, but knowing that you have to pay the first $2 or $3 or $4 or $5,000 certainly would incentivize you to let me look for that MRI where I can get it and save more money for other things I might have to pay for out of pocket. So that just makes common sense. And in today's world, especially the political world, we're seeing that there's a lot of options being presented for different ways of managing healthcare. Is the American public educated enough to be a good consumer yet? And I think that's a challenge that we're going to see going forward. And it's one that it's going to take a lot of work in order to fulfill.
Well, I have a lot of faith in someone who is self-interested. So when I am not feeling well, or my children aren't feeling well, my daughter's not feeling well, I'm very self-interested. All I want is for her to feel better. I want to repair her and help her get repaired and ease her burden. That self-interest drives people to educate themselves, to go online, to research, and to ask friends. I don't want to understate or let it pass the ability, the wisdom of the crowds. So even though individuals may not know the right path or they may not understand all their options, the fact that we all can go on Facebook and we can put on, hey, I need a doctor for this, or here's a picture of this rash on my arm, or my son got hit by a baseball. How do I tell if he's got a concussion, or should I just get him checked out anyway? Immediately, if you've got, 200-300 friends on Facebook, you're going to start to get responses back. And that crowd oftentimes somebody in that crowd, or many people, have had experience with that exact event. And that wisdom of the crowds guides people. And this is what we observe as the crowdsourcing of our diagnosis. The best a physician can do when a patient first shows up in their clinic is give them a second opinion, because that person 9 times out of 10 already has a first opinion from friends, Romans, and countrymen, if you will, from the internet. And, there are 163,000 people in a breastcancer.org group in this one forum, and that forum is entitled Concerned But Not Yet Diagnosed. 163,000. There's 800,000 people on the breastcancer.org forums altogether in all different types of categories. That's what I mean by the wisdom of crowds. They're all checking and vetting their experience and their situation against many other people who've already further down the road. And that's helping them learn and be informed and improve and make good decisions.
Yeah, the old Dr. Google is quite a physician sometimes. And if you are a physician, they quite often ask, did you go see Dr. Google first? And I'll give you that second opinion. It's very interesting to expand your knowledge and become more involved. And when you do that, you do become a consumer of your healthcare. And you do take an active role in what's going on. So what kind of advice would you give to companies out here to deal with this digital business model that they're going to have to face? What type of things would be the cookbook recipe you might share with the audience here?
Oh, well, there's a couple of things I would say for sure. Thank you. This is a great, one of my favorite questions to get. The first thing is I would think about user experience. And when I say user experience, very often that's just used in terms of a website, but it's not. It's the entire experience. Imagine that you're a mother and your daughter was out playing soccer and she clunked her head and she's laying in the back of your SUV and you're rushing her to maybe an urgent care and you're trying to dial, maybe voice dial, or maybe you're dialing with your hand and your daughter's back in the back and she's a little dizzy and you just want to get somebody on the phone and let them know, I'm coming in with my daughter. She's had a concussion. Do I need to be worried about it? Do I need to check for anything? Is it okay for her to lay down? And the first thing you hear is press 1 for billing. Press 2 for a clinician. Press 3 to reschedule your appointment. Well, that's a terrible user experience. You can't voicemail people into good customer service. And the second, so thinking about the user experience of a patient as you would if they were a consumer. Retailers, travel, and hospitality, they relentlessly obsess about the satisfaction of the consumer and their experience. How good can I make it? It's my pleasure to serve you. That's the state people have to be in. That's the number one piece of advice I would give any company. How can I make it easier, faster, more informed for you and convenient for you? The second thing I would say is that in terms of the internet, larger companies for sure, there's a wealth of information about their customer satisfaction online. It's in user ratings, it's on Yelp, it's on Google. And I would suggest that all companies should mind and mine all of their user ratings. You'll find fantastic things. There's a very, very prominent, storied health system here in the U.S. I won't say their name. They win awards all the time, number one in many categories. But if you go through their user ratings on Yelp and Google, and there are hundreds of them, and their customer satisfaction scores, what you'll begin to see is a pattern. And that pattern is junior doctors, loved my care. Yes, I got cured, but couldn't find where I was going in the parking lot. Bad billing experience. And those are little patterns that come up in the consumer experience. Well, that hospital system should pay attention to those, because if they see it come up once in a couple hundred reviews, it's no problem. If they see it come up 4 or 5 times, that's fantastic consumer feedback that should be honored. Now they know they need to redesign the billing experience, or they need to redesign the parking lot or the wayfinding experience or the front desk. Maybe they can detect that they've got some rudeness or a lack of customer affection at the front desk when somebody comes in. So I would say, think about the user experience, and you can even rely on the internet to go out and mine your ratings and be friendly and easy to deal with. These are going to become the competitive advantage because pricing is going to become parity.
Excellent. I tell you what, feedback is a gift. So look for it. Get it as much as you can. And I can't thank you enough, Ken, for being part of our coaching experience here, getting us up to speed on being better consumers. I know that our audience is going to value these insights that you've provided, and we'll put a link out there so they can find out more and do more with you as well. So it's been a pleasure having you be part of the Business of Healthcare podcast.
My pleasure as well. Thank you.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.